Stay, and I'll give you one rule that can save a life. Never use emptiness to do a therapist's job. You were sold serenity like a solvent. Pour it on the story. Watch it melt. But trauma isn't a thought. It's the body's memory of being out of power. It lives in startle, sleep, breath, appetite, vigilance. A silent cushion can soften symptoms. Wonderful. And it can laminate them under a spiritual gloss so clean you stop asking for help. Tonight, I'll separate Dharma's knife, deconstructing me from therapy's needle, stitching a torn nervous system. I'll show how non-attachment can become non-attendance, how acceptance can become avoidance, how no self can dress up as dissociation. And I'll give you diagnostics brutal enough to cut through incense. What to do before a retreat, what to say inside a flashback, and when to walk out of a hall without apologizing. I am not here to pit monks against clinicians. I am here to audit roles. Dharma trains truth under pressure. Therapy restores capacity to hold that truth without smashing the glass. If you build insight on top of unaddressed terror, you get eloquent collapse, immaculate language, avoidant life. And communities love eloquent collapse because it looks holy on camera. Here is the blasphemy that breathes. Safety is a precept. If the cushion cannot keep your body inside its window of tolerance, the cushion is a stage. We don't shame stages. We stop mistaking them for hospitals. But meditation calms me. Good. Does it also return choice to your mouth when you need to say no? Does it lower startle? Does it improve repair after conflict? If not, you bought anesthesia, not liberation. Stay. I will not sell scapulars of blame or self-care candy. I will give you criteria and a final line that refuses to let emptiness erase anyone. The postcard shows a still lake. The clinic shows a pulse oximeter. On the postcard, just observe cures everything. In the clinic, arousal has edges. Hypo, numb, foggy, gone, and hyper, amped, flooded, shaking. Meditation can push either way. A student goes quiet and the room applauds equanimity. A clinician sees shutdown. Another student sobs and the room whispers purification. A clinician sees overwhelm. Both can be part of healing if there's consent, pacing, and a path back to ordinary. Definitions before drama. Trauma equals the residue of threat that outlived the event and now hijacks perception. Mindfulness equals trained attention, non-reactivity, clarity. Therapy equals structured, consent-based methods to repattern safety, story, and skill. The Venn diagram overlaps. The jobs differ. Dharma's look closely is medicine when the nervous system can stay present. When it can't, look closely becomes a loop, re-exposure without integration. Test the room. Does the community have red flags posted, panic protocol, opt-out language, referral list? Are teachers trained to name physiology, freeze, fawn, flight, not just ego? Is there a rule that leaving is practice? If your Sangha only praises sitting longer, it's training compliance, not compassion. The adult sentence, capacity before content. The order matters. Build regulation, then insight. If you can't slow breathing, widen vision, feel feet, and choose when to stop a scan, you're not meditating. You're auditioning for sainthood. Sainthood prints posters, capacity changes Tuesdays. No self is not no sensation. Empty is not absent. When people armor terror with Dharma, the armor sounds sacred. I'm unattached. It's just phenomena. Pain is empty. Maybe. Or maybe the body went away because that was safer once, and now the practice rewards going away. Dissociation wears the same robe as insight if your only test is how calm you look. Here's a field test. Insight widens contact, more texture, more intimacy, more grief that moves. Dissociation narrows contact, fewer colors, fewer nouns, grief that narrates but doesn't resolve. After an emptiness hit, ask, am I more able to call my sister and apologize? Can I taste food? Do I know where my keys are? If life degrades while your metaphors get prettier, you are practicing erasure with excellent posture. Communities collude. They love the student who never complains, never asks for resources, never makes it about me. That student is starving in holy clothes. Stop praising vanishing as virtue. Emptiness is a tool to cut reification, the trance that turns patterns into persons, not a license to neglect injuries. If a teacher tells you your flashbacks are just sensations, ask them what the exit is when the room tilts. If they call exit attachment, exit faster. The antidote is boring and life-saving specificity. Name the body, the time, the trigger, the boundary. Emptiness survives facts. Dissociation avoids them. If your philosophy withers when you supply nouns, it wasn't philosophy. It was anesthesia with Sanskrit. Your vagus nerve is not worldly. It's wiring. Fear learned a gate to keep you breathing. Now it runs when feet are safe. Meditation that bullies physiology creates tidy disasters. What heals? Titration, a drop not a flood. Pendulation, move toward away. Choice, stop continue. And co-regulation, safe eyes, safe voice. These aren't brands, they're physics of mammals. Sit through it is sometimes courage and sometimes reenactment. Without anchors, sightline, breath rate you can steer, touch points, open monitoring can become open bleeding. Here are 4 green lights. 1, you can orient to the room without losing the thread. 2, your breath obeys you. 3, you can name 3 external sounds. 4, you can say pause to yourself, and it works. 4 red flags. 1, time skips. 2, limbs go missing. 3, the teacher's voice is far away. 4, old scenes replay in HD. Red flags mean change method or change room. Isn't this therapy? No. It's guardrails that let Dharma do its job. The mind can face itself without flinching once the body trusts the floor. Courage without capacity becomes cruelty to yourself in sacred language. I am not impressed by endurance. I am impressed by people who know where the break is and use it before the cliff. Write this on your altar. I can stop. If your practice doesn't allow it, that isn't Buddhism. It's a cult of stamina. Enlightenment doesn't need your panic as an offering. Therapy is not a rival monastery. It's a set of accountable containers. Consent, confidentiality, pacing, repair, scope. Modalities differ. CBT trims loops, EMDR reprocesses, IFS parts maps, somatic work widens capacity, trauma-informed psychodynamic stitches, story, the common thread, a relationship with duty of care and levers to stop harm now. Dharma offers a different lever, truth under impermanence. It cuts clinging, empties idols, humbles identity. When people try to swap tools, harm follows. Using Dharma to treat acute trauma is like using a scalpel to hammer. You may hit something, you will break more. Using therapy to fix nihilism is like using a hammer to operate. Some relief, no realization. Respect the instruments. Ask these adult questions. Is there risk if this goes wrong tonight? Self-harm, dissociation, domestic danger? If yes, the correct container is the clinic, not the cushion. Do I need witnessed repair with a human who owes me duty? If yes, therapy. Do I need existential clarity that no technique can purchase? If yes, Dharma. The map is boring. Boredom is what saves you from charismatic errors. And for the purists, early Buddhists invented Sangha rules: grievance, confession, restitution. That's governance, therapy's cousin. Acting like we only meditate here is not traditional, it's amnesia. Integration isn't romance, it's order of operations. My sequence: safety, skills, story, stillness, safety, stabilize sleep, food, shelter, violence, risk. If these wobble, practice equals escape. Skills: downshift arousal on purpose, orienting, paced breath, contact, upshift when numb, movement, cold water, voice. Story: with an ethical witness, tell what happened until meaning returns and blame leaves the child. Stillness: now insight can land without being a sedative. 5 green lights to add heavier Dharma. 1. You can stop attention deliberately. 2. Fewer lost hours. 3. Repair in relationships is faster. 4. Flashbacks decrease in both intensity and pride. 5. You remember lunch. 5 red flags to pause retreats. 1. Glittering nihilism, nothing matters. 2. Moral anesthesia, no guilt where repair is due. 3. Compulsive asceticism. 4. Euphoria after all-night sits followed by crash. 5. The word emptiness appears whenever anyone asks for boundaries. Integration also means referrals. Teachers should have lists of clinicians. Clinicians should know when a student is ready for austerity. Maturity is a relay race, not a turf war. If a hall can host tears, it can host policies. Post them. No forced disclosure, no spiritual penalties for leaving, clear panic protocol, name safeguarding leads, anonymous reporting, print referral directories, fund therapy stipends before statues, rotate roles so the kind-hearted don't become permanent sponges. Teach teachers to say, I'm out of scope, and mean it. Teach students the phrase, I need a different container, and honor it. Also, retire the gaslight phrases, attachment to comfort. Ego hates the path. This is purification. Sometimes true, often lazy. Replace with checks. Are we in consent? Are we within capacity? Is there a plan for repair? If the answers are murky, you are worshipping mood, not Buddha. Donors fund boring things. Grievance councils, supervision, childcare, lights, winter. Optics love the ethereal. Safety loves receipts. If your compassion center cannot publish a duty of care budget, you run a stage, not a refuge. I don't want less devotion. I want devotion that doesn't eat people. A Sangha that wears emptiness but can't say who handles a panic at 2 a.m. is playing Dharma on easy mode while the vulnerable pay expert difficulty. Grow up. It's gorgeous. You can have both. The blade that cuts delusion and the bandage that keeps the cut from infecting your life. Keep emptiness. Keep therapy. Keep your dignity most of all. The final rule I promised: if a practice asks you to witness your pain but refuses consent, capacity, or repair. It's not Dharma, it's theater. Call it what it is and change rooms. This week, do 3 adult things. 1. Write your opt-out sentence and memorize it. 2. List humans with duty: therapist, doctor, elder, friend with 3. Downgrade any practice that punishes boundaries from sacrament to hobby. Sacred things survive demotion. Cults don't. For teachers, preach fewer slogans, publish more procedures. For therapists, bless awe when it arrives. It keeps people tender enough to work. For seekers, audition rooms, not identities. The right room will make you heavier where it matters: accountability, affection, follow through, and lighter only where it's kind. Shame, doom, pretense. I will not make your pain poetic. I will make it negotiable. Then you will practice without fleeing yourself and heal without firing your soul. That's adulthood in robes. I will never use emptiness to erase you. I will use it to end the lie that told you to disappear.